The term low back pain has been described as any discomfort that happens between the area of the 12th rib and the inferior gluteal fold. At some point or another, it's not a stretch to say we'll all have a stint of it. The lifetime prevalence of it in the general population has been suggested to be as high as 85% after all. Thankfully, most episodes can be recovered within 6 weeks. Still, there is a fraction of the population that will develop chronicity, defined as pain persisting for longer than 12 weeks. If you're someone who falls into the latter group, you'll be well aware of the troubles this can bring, like high pain severity, disability, economic loss due to decreased work hours, frequent trips to healthcare services, and a poorer quality of life. In addition, chronic lower back pain has a considerable impact on many persons' mental health, with an increased risk of depression, anxiety, and sleep disorders. Accordingly, in an attempt to help with this, you may have thought about getting a lower back scan done for more transparency into what's going on and hence help orientate your rehab better. But could they actually do more harm than good? Today we're getting into it. But first, as always, please take note of our disclaimer. To get more specific, the most common types of scans carried out for low back pain are radiography, CT, and MRI. Radiography, also known as X ray imaging, which you're probably more familiar with, is done by sending X rays through the body, which are picked up by a detector to create an image of you internally. X ray beams find it difficult to pass through dense areas of your body and find it easier to travel through soft parts. As a result, bone shows up as clear white on X rays, while things like the heart and lungs show up as darker areas, which collectively helps to create the standard X ray image. This is how standard X ray imaging is used to assess bones, cancer, and pneumonia. In comparison, CT or computed tomography scans also use X rays. However, unlike standard X ray imaging, which only gives a 2D view of the body, a CT scan gives you a 3D one, due to it taking multiple X rays from different angles while being combined with computer processing. From this, in addition to providing a high quality image of bones, CT scans can also be used to evaluate blood vessels, soft tissue, and organs. So, why bother having X rays then if we have CT scans? Well, CT scans are more expensive and aren't always readily available like X ray machines are. MRIs then share some similarities to CT scans. MRIs also provide 3D high quality images of bones, blood vessels, soft tissues, and organs, and in both procedures you'll be asked to lie down on a bed that will then slowly and automatically slide into a circular scanner. But as opposed to both the CT scan or the standard X ray machine, which uses X rays, the MRI uses radio waves to bounce off fat and water to form an image. Other differences is that the MRI is even more expensive than a CT scan and takes about an hour to complete versus 10 minutes commonly for the CT scan. Still, the MRI is considered to be the gold standard for imaging of the lower back, since it can distinguish different structures within the intervertebral disc, visualize ligaments, assess bone marrow composition, and evaluate the contents of the spinal canal. Okay, so now we've a better idea of the scans we're talking about in relation to low back pain. How could they possibly do more harm than good if they're just giving you further information? But just on a quick side note, if you'd like to undertake our evidence-based and results-backed personalized Plato weight management program, please click the link in the top right-hand corner of the video or follow the link in the description. Hall et al. In 2021 lays out the potential dangers of imaging scans in great detail. Indeed, once upon a time, they were a routine part of diagnostics for the sheer amount of low back pain cases. However, current research suggests that they're only helpful for around 1 in 10 persons who are suspected of red flags like cancer, infection, inflammatory disease, fracture, and severe neurological deficits present. For the remaining population, the researchers propose that using scans can be harmful because many of the findings found through their use are actually incidental, which could be incorrectly diagnosed as a source of pain. For example, bulging discs or degenerative disc disease are commonly seen on scans in up to 97% of symptomless people. These things are normal, common age related changes. This oversight can be detrimental as it can lead to unneeded further investigations, specialist referrals, and even more intensive treatment like surgery. Also, incidental findings could cause unnecessary stress for patients from a labeling effect, which could potentially delay recovery by making them want to start avoiding physical activity. And we mustn't forget that X rays and CT scans emit radiation too, even if they've been shown to carry a low cancer risk. Nevertheless, despite our increased awareness of all of this now, it's been estimated that still 1 in 3 of imaging scans are being done unnecessarily today. The main factors influencing doctors to order them needlessly have been highlighted by Hal and colleagues as believing the imaging will reassure a patient, not having time to explain a non imaging approach, and possibly the worry about missing a specific pathology. But some patients have to take some of the blame too, as they can put considerable pressure on doctors for the scans, even if they're advised against them. Therefore, in sum, although back scans can be very helpful when it comes to confirming low back red flag suspicions, keep in mind that cases of specific spinal pathologies make up less than 1% of cases in primary care. So, if your doctor hasn't expressed concerns about red flags, getting a scan won't be worth it since it won't help guide the treatment of your lower back pain any better and could very well actually make things worse. Instead, it's advised to seek conservative treatments such as physiotherapy, cognitive behavioral therapy, or pain management. Have you had a low back imaging scan done before? What have your experiences with it been? We'd love to hear from you in the comments section down below. Additionally, if you're new here, make sure to like and subscribe to our channel. So, that has been our video. Thanks for watching, and I'll see you next time.